I just look like a hot mess. All right. 1 second while I adjust myself. All right. Well, hello, everyone. It's your girl, Gabrielle. Welcome to a brand new episode of Hot Topics. So, for those of you who have no idea what this show is about, let me tell you what this show is about. This is a show where we talk that real talk about things that are happening in education, employment, mental health, social services, finance, divorce, or anything else that is steamy. And we've been doing this show for a while now, and y'all got to catch up. We've been doing this show for a while. Uh, but nonetheless, welcome to the show if you are new, and I look forward to getting to know you a little bit. All right, so with that said, let's get into it. So I am excited about this topic because being a major of clinical mental health counseling, I am looking forward to this particular discussion. And let's get into the topic of the episode. So, the topic of the episode is, what is anxiety disorder? Right? So, I'm looking forward to having this discussion as a psych major, mental health counseling graduate major. Is that what it's called? So I'm very much looking forward to talk mental health. So this is awesome to be able to do this. So what is anxiety disorder is the topic of the episode today. And I have a guest with me who's going to help me out with this discussion. Her name is Dr. Ashley Funk, and I'm going to tell you about her. So let's get right into it. Who is Dr. Ashley Funk? Let me tell you who she is. So, Dr. Ashley Funk is the owner and founder of Paradise Psychology in Fort Worth, Texas. As a licensed psychologist, Dr. Funk specializes in the treatment of anxiety disorders and helping caregivers manage unwanted behaviors displayed by their children. She is also passionate about helping her clients improve their relationships through open, effective communication and healthy boundaries. Dr. Funk enjoys spending her leisure time with her fiance and their two cats, Honey and Luna. Awesome. All right. Well, without further ado, I'm going to bring Dr. Funk to the stage.
Hi, thank you for having
Hi.
me.
Hey, thank you for coming on. How are you doing today?
I'm doing well. How are you?
Pretty good, pretty good. All right, so we're here to talk anxiety, or anxiety disorder. So I am just gonna pass the baton to you, and I'm just going to have you jump right in. So, Dr. Funk, please tell us, what is anxiety disorder?
All right, so first I gotta start off with a little disclaimer. This is just for informational purposes. This is not therapy, nor is it supposed to be substitute for therapy. So now that we have that out of the way. Um, so what is an anxiety disorder? So there's actually a whole class of anxiety disorders. So there's social anxiety, which is kind of the fear or social discomfort. So when you're in a big group of people, you may kind of have a fear of embarrassment, feel like you're being weird or socially awkward, or you may replay social situations over and over in your head. There's also panic disorder where you have panic attacks. These could last a few minutes, but they're very intense. There's also separation anxiety, which is seen a lot of times in children. So, fear of being separated from family members. It could be the parents or it could be siblings, and also worrying about the safety and well being of those family members. It could come out in nightmares or just fears and worries. And then there's generalized anxiety. So, this could be worries and what ifs about anything, future, yourself, other people and what they think, your career, school, you name it, hence generalized. So we look at this overarching anxiety, and everything it has in common is it's a future emotion. So fear is very present based. We're fearful of what's happening right now, whereas anxiety is future oriented. We're anxious about what might happen in the future.
Thank you so much for that, Dr. Funk.
Mhm.
So, can you go into the difference between what is um, what is like normal general fear and what is a disorder? Because
Mhm.
I've been to therapy myself, and I've been diagnosed with generalized anxiety disorders. Um, so I wanted to, if you could explain the difference between um, when is it like normal fear, and when is it like this needs clinical attention.
Yeah, of course. So the big thing that we look at is it causing distress or impairment to functioning? So we always think of stress as a bad thing. Well, there's actually two types of stress. There's what we call eustress, which is good stress, and there's distress, which is the bad stress. Eustress is kind of that motivating stress that, helps you to focus on like a test or an exam. It helps you like over prepare or prepare enough for something. It makes you motivated. It's just that level of nervousness that helps you do well. Distress, like, is being too nervous or too fearful or too anxious to the point of impairment. So it may keep you from doing social activities, or it may impact your relationships with family or friends or your significant other in a negative way. So it may cause you to be irritable and have irritable outbursts, or like for a child, it may keep them from going to school, or they may have tummy aches or headaches frequently without a medical cause. Another impairment could be it keeps you from doing well at work where you can't get your job duties completed. Or it may be impacting your sleep where you're having nightmares or you're very restless or you're having insomnia. Or the opposite could be having hypersomnia, you're sleeping too much. So, really, what we're looking at is it becomes clinically significant when it's impairing you in some area of your life.
Thank you for sharing. And speaking from personal experience, I feel like every single day like the sky is falling, and so I definitely I definitely understand what you're saying, and speaking from personal experience. So let's talk visuals, right? So
Mhm.
what does anxiety, I keep thinking anxiety and an anxiety disorder. So what
Mhm.
does anxiety disorder look like? So as if I were an outsider looking in and someone said,
Yeah.
um, you know, uh, that they had anxiety disorder, as an outsider, what would that look like?
So it really depends because there's so many different anxiety disorders and it's such an individual thing. So, for instance, if we look at social anxiety would look like getting invited to parties or getting invited to social gatherings and saying no all the time. Or maybe you show up, but you isolate yourself, you stand in the corner, you don't really talk to anybody, you might trip over your words. Or it may even look like replaying that social situation over and over and over again in your head and beating yourself up because you feel like you said something stupid. Whereas panic disorder or agoraphobia could be, we'll take agoraphobia, it could be never leaving your house because you're afraid you're going to have a panic attack out in public. So you never go anywhere. So you always get groceries delivered. You can't, do any employment except working from home because you can't leave the house. You don't want to let people in your house. Being completely socially isolated. Panic disorder could be, people may hyperventilate, their heart races, They feel like they're having a heart attack or they're about to lose control, uncontrollable crying, and like little short spurts. And it's a very intense, very scary thing. A lot of times, these people will even present in emergency rooms because they feel like there's medically something wrong, like they're dying. And whereas generalized anxiety, there's kind of two camps with generalized anxiety. We have the individuals who have like a very strong impairment in functioning, where they're really struggling at work or school. They're not, maintaining social relationships very well. And then we have kind of the high functioning generalized anxiety. So these are the people that they look very achieving, like almost overachieving, but they may be the ones quick to kind of have a quip or be self-critical, and they're very perfectionist, and things have to be exactly this way. And you may see them like one little thing goes wrong and they almost overreact. Well, it's not that they're overreacting, it's that they are holding so much in that that one little thing is kind of the last straw, and it becomes too much because we all have our threshold. And once we reach that threshold, enough is enough. So it may just look like, having that what if and being easily overwhelmed, having difficulty concentrating, difficulty sleeping or getting restful sleep, as well as irritable outbursts. In children, especially somatic concerns, meaning headaches, tummy aches. You may see school refusal, like, I don't want to go to school, or not doing well in school. So changes in their academic performance. You may see things like loss of relationships. And a very small subset of individuals may even turn to substances to try to manage that anxiety.
When you say substances like what?
So some individuals will use illegal or illegal substances to try to manage anxiety. That's a very small subset of individuals, but it is something, I do think too, when anxiety is very impairing, there are psychotropic medications that psychiatrists or physicians will prescribe. Some of them are a class of antidepressants, actually, but they also work for anxiety. And then you have a class called benzodiazepines. These are not meant to be used long term. These are actually meant to be a short term fix until you are able to work with like a mental health provider to better manage the anxiety and then be weaned off of the benzodiazepines, because benzodiazepines are quite addictive. And they're also one of, I think, like two substances that are legal that the withdrawal of benzodiazepines can actually be fatal. So you never ever want to stop those just cold turkey.
Mm. Right. So you bring up an interesting point that there are people that take psychotropic medication, and then there's those that seek illegal substances.
Mhm.
I'm assuming you mean things like alcohol, like marijuana, to deal with their symptoms.
Mhm.
Um, Particularly those that take the psychotropic medication. You're saying just taking the medication is not enough; that it should be paired with psychotherapy.
Yeah, so research actually shows that the most effective approach to treating the majority of mental health issues, including anxiety, is a combination of therapy and pharmacological management. Now, pharmacological management, if the symptoms are severe enough. So if your impairment is so great that like you're barely holding your job, you can't maintain a social relationship, or you're about to flunk out of school, or you can barely get out of bed in the morning, pharmacological management or taking psychotropic medications may be appropriate for you. And that's something, discuss with all of your providers. So a mental health provider that you're seeing can always consult with a release of information with your physicians, including psychiatric providers, to discuss what's appropriate and talk about what they're seeing. Because that's, good continuity of care. And again, there are those medications like SSRIs, which are selective serotonin reuptake inhibitors. That's a class of antidepressant that's fairly common and prescribed pretty often, that also helps manage anxiety. They're not addictive, and a lot of people take them lifelong. Whereas, like I said before, benzodiazepines, we know these to be addictive, and they were originally, prescribed for short term or meant to be short term. I've seen people on them for a very long time because it's quite difficult to get off of them sometimes. But you never ever, if you are on them, you don't want to just stop taking them. You have got to work with your physician, your prescriber, to make sure that you wean yourself off of them properly.
So are you saying people have gotten addicted to benzodiazepines?
Yes, some people do. Some people, it happens when it's legally prescribed. Other individuals obtain them via illegal means.
Mm, interesting. So how often does that happen?
Hard to say. I think it's very hard to say. There, I think people use such substances for different reasons. It, I've seen it. So a little bit of my history. I previously worked in a substance abuse rehabilitation facility. So we did have quite a few individuals that either were prescribed benzodiazepines or they were obtaining them illegally. And that was one of the substances they had become addicted to. Um, I, again, do think it's one of two substances. So benzodiazepines and alcohol are one of two substances that are addictive. Both of them, the withdrawal can be fatal if your tolerance is high enough. So not always, but the withdrawals can be fatal. So, it is not something to take lightly.
And so that's why it's important to, if you ever decide that, if anyone decides to take medication, to, as I always say in those commercials, consult a doctor first before you take any medication.
Yes, I do think, it is a conversation to have with all of your providers as well as your prescriber. And remember, your pharmacist is also someone that you can rely on because they went to school to know about all of the medications. So you can also ask your pharmacist and they should be able to answer a lot of the questions as well.
All right, so now let's get to the $1 million question. How do you treat it? What's the answer? What's the cure?
Yeah, so there are actually about 4 or 5 main or most popular modes of treatment, like therapeutically, for anxiety disorders. So one of those is CBT, or cognitive behavior therapy. So cognitive behavior therapy, or CBT, looks at the following. It looks at your thought process and how that interacts with your emotions, your behavior, and your environment. So, with the understanding that we can only change so much of our environment, we do what we can, and then we have to recognize what's out of our control in that respect. Then we look at our behavior and we try to cause some shifts in our behavior. Are we doing anything that's kind of adding to our anxiety, or are we reacting to situations in a way that's kind of, problematic? And then we recognize, our emotions just kind of happen. There's not a way that we directly can impact our emotions, but we can indirectly impact our emotions. And that's by managing our thoughts. So cognitive behavior therapy really hones in on those thought processes. So especially the what if, like, what if tomorrow I flunk that test? Well, I'm going to flunk that test, then I'm going to fail the class. If I fail the class, I'm going to fail the semester. If I fail the semester, I'm going to flunk out of school. If I flunk out of school, I'm never going to get a job. If I never get a job, I'm going to be homeless. And if I'm homeless, what am I going to do? So then, you have that snowball effect and it just kind of rolls and rolls and rolls. So what CBT would do is it looks at that train of thought and it challenges it. And it just kind of says, okay, so what is it about this thought that is incorrect or irrational? And we challenge it head on using past experiences like, okay, you failed a test before, you didn't fail the class. Or if you failed a class before, you didn't flunk out of school, so you were fine. And it looks at that, or we reframe a thought. So we reword a thought. So it really focuses on thoughts that are problematic and how to change them and how to make them more appropriate and more functional. So that's CBT. And then we have what's called mindfulness. So mindfulness was originally created, and it was created for chronic pain patients. So chronic pain patients that either couldn't have surgery or they couldn't be prescribed opioid pain medications or these things were not effective for them. So mindfulness is about being in the here and now. So again, anxiety is a very future oriented emotion. So mindfulness wants you to focus in the here and now. So by focusing on the here and now, it snaps you back to the present. And it is kind of also looking at your thoughts for just what they are. And mindfulness is very sense based. So a lot of times it's like leading people through like, what do you see right now? What do you smell right now? What do you taste right now? What do you hear right now? And it helps in that calming. So there's a lot of deep breathing and there's a lot of progressive muscle relaxation and things like that to help calm the nervous system down and the physical responses that we'll have to anxiety. That's mindfulness. And mindfulness plays into a lot of other ones like mindfulness-based stress reduction or mindfulness-based cognitive therapy. So those components kind of go into that. And then we have acceptance and commitment therapy. There's a little bit of a mindfulness component in that, but acceptance and commitment therapy is like this. So when we have anxiety, what do? We want to avoid it. We want it to go away. We don't like it. We think it's bad. We lean out. So we're like, nope, no, thank you. I want this gone. Don't like it. Make it go away. So what acceptance and commitment therapy does is it wants you to lean in. So it wants you to lean into that anxiety and acknowledge it. Accept it. Not like it, but accept it. And in a non-judgmental way. So when you have an anxious thought, instead of going, oh, like, why am I thinking about this? Like, I just want it to stop. You just go, okay, I'm having the thought that I might flunk my test tomorrow. It's just a thought. That's all it is. Nothing more, nothing less. And it can go. And then the commitment part of that is committing to change. So deciding what your values are and committing to the change of, I commit to change the way I look at my anxiety and that it is just an experience that's happening. It doesn't control me. It doesn't need to overwhelm me. It's just there and I can let it go. I'm not going to hold on to it. I'm not going to try to push it down. It's just there. And then we have dialectical behavior therapy. So, which is DBT. Dialectical behavior therapy was originally created by Marsha Linehan for borderline personality disorder, but it's since been adapted for a lot of other mental health issues, including anxiety. So this goes through a lot of different things. It looks at distress tolerance, interpersonal effectiveness. It goes through a slew of things. It also does a little bit of mindfulness. So it looks at emotion mind and wise mind. Emotion mind is that piece of you that is just very reactive. Situation happens and you are just like, bah, like, I don't know what to do right now. I'm freaking out, like overwhelmed, can't function, like somebody help me. Wise mind is the very logical part of you that is able to kind of be calm and say, okay, what are the facts? What do I need to do? What's the goal? What's the problem? I need to fix this. And it kind of lays that out. So those are kind of your biggest modes of treatment for anxiety.
And I don't know if you can speak to um, how long does each mode take?
That is a very individual thing. So there really isn't any length of time. I've seen people go for 6 to 8 sessions. I've seen people that go for years. It is a very, very individual thing. So it's kind of what you need and, what you need to achieve your goals.
Okay. So how do you know which mode to use? I know it's very individual, but how do you know which one to use? Like what type of person will benefit from any of the mode?
So I can only speak for professionally kind of how I do it. Everybody kind of has their way that they like to do it. So, if you go to psychologytoday.com and you look in the directory and you hit the specialty anxiety and you look at all the therapists, all the psychologists, all the providers that do anxiety, you're going to find a lot of different modes of treatment. And it is, partially based on our education and kind of our niche and what makes sense to us as providers. So my approach is pretty integrative. I have a very strong foundation in cognitive behavior therapy, but when I work with anxiety, I tend to integrate, meaning I have a foundation in CBT, but I also pull from acceptance and commitment therapy. I pull from mindfulness. And occasionally I'll pull from DBT. I do not ever do strict DBT because it is extremely intensive. And I just do not have the resources to do strict DBT because a strict DBT provider is going to be available almost 24/7. So, I pull from those things and I kind of integrate because my outlook or my perspective on it professionally is I'm going to give you as many tools as I can as a provider. So that way we're going to see what sticks and what works. Because my goal is for you to not need to see me anymore. For me to basically put myself out of a job, which I know seems counterintuitive, but that's basically what I'm here for. It is such an individualized process that knowing as a provider that I could give you an exercise. Like I could say, okay, here's a progressive muscle relaxation, and I want you to do this every time you feel anxious. You can come back to me next week and say, that didn't work. It didn't help. And that's okay. Not everything is going to work for everybody. It's just sometimes trial and error in figuring out what makes sense and what clicks with that individual.
All right. So I don't know if you're open to doing a little bit of role playing. So if I said, hey, I'm afraid, I'm afraid, I'm trying to think. Or what would you say to, I gotta think about it now. Or someone with, who's worried about their looks. I'm afraid, or let's do a simple one. Like someone has a job interview. Oh, I'm afraid I'm gonna do poorly in the job interview, and I'm not gonna get the job, and I'm gonna remain unemployed. How would you treat that person?
So I would do a little investigation. So I like to do a line of questioning to kind of lead the person where they need to go. So somebody comes into my office and says, I have a job interview tomorrow and I think I'm going to fail and I'm not going to get the job. First thing I'm going to ask is, how many other jobs have you had? If they say, well, I've had a lot of other jobs, I'm like, okay, so how many interviews have you had? They tell me I've had 10 other interviews. How many times of those 10 interviews have you gotten a job? They say 8. Okay. So 8 out of 10 times you interviewed, you got the job. So that's a majority. So why, what's the probability of tomorrow you not getting the job after the interview? And then, you see the light bulb and they're like, oh, well, yeah, I guess it is a higher probability I get it than I don't. On the other hand, if I say, well, how many other jobs have you had? And they're like, none, this would be my first. Okay. So let's think of it this way then. Tomorrow you go in for the interview. Is this your first interview? Yeah. Okay. So say tomorrow you go for the interview, you don't get the job. What happens? Well, I don't get the job. Okay. Worst case scenario, I don't get the job and I'm still unemployed. So what do you do then? Well, I don't know. And I'm like, can you apply for another job? Yeah. So it is, kind of just leaving them there to like recognize worst case scenario doesn't mean the end. Doesn't mean you failed. It just means you have to seek another opportunity. So it's just kind of pushing them past that stuck point of that thought and coming up with a plan to move past that. And then once they see, oh, it isn't the end of the world if this doesn't happen. It's okay. That's, it's normal. And I'm like, everybody sometimes when they don't get the job, the first interview, nobody's perfect the first time they do anything. It's a learning curve. That's okay. So it is, kind of helping a client get to that place.
Awesome. And you have I just wanted to share this comment.
Hi, Darius.
Love to hear this. So needed right now. All right, you have a cheering section there. Awesome, awesome. All right, so what about if like a woman is on a date and she's like, oh, I'm afraid he's gonna think I'm ugly. I'm afraid he's gonna think I'm unattractive and he's not gonna want to date me, or what would you say to that?
So that could go a few different ways. So in the moment, it is kind of doing a similar thing of the job interview, like saying, okay, how many people have, there's a few different ways I do that. When people talk about their physical looks or things like that, I kind of challenge it a little bit. Who's told you that? And the majority of the time people say, well, nobody's ever told me that. And I'm like, okay, so nobody's ever told you that you're ugly. So why do you think you are? And then they just kind of sit there and look at me a little bit, and then we kind of investigate it. So, in cognitive behavior therapy, we look at 3 different things and thoughts. We have what's called automatic thoughts, which are those thoughts that are kind of shallow, like the what ifs, and they just kind of go pop, 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 like they just pop up all day long, pretty speedily. And then we have what's called intermediate beliefs, which are kind of the middle tier, digging a little deeper. So think of like your brain or yourself as an onion. And part of what I like to do is peel away all those little pieces and get to the center. Intermediate thoughts are a little deeper. Those are your rules and assumptions. So the shoulds. If I were pretty, I should blank. Or if I were a good daughter, I should be this. Or if I were a good worker, I should blank. It's all those rules and assumptions of life. And then you peel it even further, you get to what's called the core belief. Those are your beliefs about who you are, who everybody else is, about what society is, what the world is, what the future holds, all of that. And some people are not immediately aware of what their core beliefs are. So with something like that, it might be kind of digging away slowly at that to see if there's a core belief that is holding on to body image. Does somebody have something that's affecting their self-esteem? Or do they have a negative core belief of self that is causing them to have these thoughts that other people will view them in this negative way? And trying to get to that, because once we get to that core belief and we get to that root of what's going on, then we can create that shift, and that'll kind of, spiderweb out and alleviate everything else.
Interesting. So now, what would you say to someone, who's worried about paying their bills? So I think that was the cause of a lot of my anxiety. is, not having enough money to pay the bills, and so, you know what happens when they when they can't pay the bill, and what happens to that. So how would you help that person?
So here's the thing that I think a lot of us need to know as providers too, is not all anxiety is invalid. And what I mean by that is sometimes, if somebody comes in and they have financial anxieties, we're going to talk about it. And we're going to say, okay, what is the financial situation right now? And with financial anxiety, sometimes that financial anxiety is completely valid. If financial resources are tight and there may be trouble paying bills, keeping the lights on, keeping food on the table, keeping a business open, whatever it is, normalize that anxiety and validate it. And then move into troubleshooting. Okay, so this is our reality right now. So what can we do to move forward and find you support and help and make it so that that financial stress is less, and try to work on that, because that is not a thought to sit there and try to challenge or reframe or restructure, because that's a very valid thought for a lot of people, and I'm not going to sit there and tell them like, oh well. No, that's a valid thought. That's a valid concern for a lot of people, especially nowadays. So that is how I would approach that type of concern.
Would you say the same for someone who is worried about racial discrimination, gender discrimination, or what's going on with the war in Ukraine right now in terms of the like the physical assault and the verbal assaults towards the Russian population? Um, would you would you also use that? Would you also say those anxieties are also valid?
Yes. Unfortunately, I have worked with quite a few individuals who are very different from myself, whether it's due to gender, race, ethnicity, heritage, culture, you name it. I've seen a lot of individuals that are different from myself. We belong to different groups. And those discussions have come up. And a lot of times I listen to their experiences because they are the expert of their own experience, not me. I don't know their experience. I have not lived it. I don't know it. They do. They're the expert in that moment. I'm just here to listen and learn and hear that. And in that setting, my job is to normalize and validate and to help them process what they're experiencing. Because there is a lot of discrimination, there is a lot of oppression. Society and the institution that we live in is structured in a way for a lot of people that it does not do well by them. And that is something that unfortunately a lot of people don't always have a listening ear, and they don't always have a safe place to express that or speak about that. And the least I can do as a mental health provider is provide that safe space for them to come in and discuss that and process that.
Hmm. So is if someone says, okay, role play over, good job. So if someone says they have anxiety or they have anxiety disorder, and someone responds, it's all in your head, do you think that's what do you think of that response? It's all in your head, it's all in your mind.
um, that is not a good way to respond to anybody that says anything. Unfortunately, I have I myself have been in that position. I had a, self-disclosure, I had a medical issue that was pretty severe, and I've been told that, and it was not in my head. I don't think that's something to say to anybody because I think a lot of times we have a tendency to tell individuals, it's all in your head, or just stop thinking like that, or stop feeling that way. Well, if we as individuals could stop being anxious, could stop feeling depressed, could stop experiencing things that cause us discomfort or, distress, wouldn't you think we would do that? It isn't always that easy. And, that's why we as providers are here. Like, we're here to help individuals and support individuals because, that's what we went to school for. That's what we were educated on. Nobody is necessarily born knowing how to do all these things. If we all were, people like me would not be in the jobs that we're in. And I think there are appropriate ways to respond. And I think the best thing that somebody could do, if somebody comes to you and says, I'm feeling really anxious right now, or I was just diagnosed with an anxiety disorder, the best thing you can do for that person is listen. Don't try to fix their problems. Don't tell them it's all in their head. Just sit and listen to them. You can ask them, what can I do to help? But no, they may not even know what to tell you. They may not know what they need or in that moment. May not know what you can do to help. And that's okay. But the best thing that you can do is be there to listen.
Absolutely. Absolutely. All right. Well, we are starting to wind down. So, do you have any final words of wisdom that you'd like to share with our audience? Any final words of advice?
Yeah, final word of wisdom or advice is if you are experiencing anxiety and you're not sure what to do and you feel like it is impairing or, it's causing you distress or impairing an area of your life, please reach out. There are a lot of directories online where you can find help, and please reach out to a mental health professional near you. And keep in mind, if the first one you're not a good fit, it's okay to seek somebody else and find that good fit for you, and know that there are people like me out there that are willing to help and support you.
Awesome. Thank you so much, Dr. Funk, and thank you for this lovely talk today. So, I'm going to put up your banner here. All right, you guys. So you can find Dr. Funk. She is on the web. She is on that social media. So definitely check her out. Her and her phone number. So give her a call. Right? So go to her website. You can learn about her services. She is on Instagram and Facebook. Definitely follow her, and LinkedIn. So check her out as well. Dr. Funk, can you talk about your practice?
Yeah, so my practice, Paradise Psychology, is in Fort Worth, Texas. I do in-person and telehealth services. So I provide, like I said, in-person telehealth services to any resident in the state of Texas. So feel free to look me up, and I look forward to hearing from all of you.
Awesome. And you got some more fanfare here. Are those hands? Okay. Oh, those are hands clapping.
Yep.
I'm like, what emoji is that? Okay. And we want more of her. I guess he's a friend of yours.
Yeah, thanks, Darius.
Awesome. As there you go, right? So you have some fanfare there. Yeah, so definitely, you guys watching. Oh, clapping. Thank you. um, yeah. So you guys check her out on social media, visit her online. All of her information is scrolling below at the bottom of your screen. And for those of you watching this on our YouTube channel, all of this information will be provided in the description. All right, so Dr. Funk, thank you so much for joining me today.
Yeah, thank you for having me.
All right, I'm going to place you backstage now. All right, and you guys, it is just. Oh, wait, is that another emoji? Okay, it's cute. All right. All right. So now it is just you and me. Now it is just you and me. All right. So we have reached the conclusion of our episode. Thank you so much for joining us today. Wherever you are watching this episode right now, whether that is on YouTube, Twitter, Facebook, if you're watching us on our website, if you're watching this on Instagram, wherever you're watching this episode right now, please check out our social media and our website for more videos and clips, and don't forget to follow us. And while you're at it, let us know what you thought about this episode by leaving a comment in the comment section below or in the comment thread. I would love to hear your thoughts. And as a reminder, this web series is a production of A Step Ahead Tutoring Services. So if you would like to learn more about our company, the services that we have to offer, if you want to know more about me, if maybe you're looking for tutoring services for your children or even for yourself, please check us out online. Our information is scrolling below, but I will say our website. Our website is www.astepaheadtutoringservices.com. And there's a special promotion going on right now. If you mention that you heard about us from our Hot Topics web series, we will give you 15% off the next 6 hours of tutoring. So definitely take advantage of that coupon when you reach out to us. Say, we heard about you from Hot Topics. Boom, 15% off 6 hours. Definitely take advantage of that coupon. And I also want to encourage you to sign up for our email list and our texting list. You will receive even more special promotions from us, as well as special announcements and special promotions. So definitely stay in touch with us. There are so many ways that you can stay in touch with A Step Ahead Tutoring Services, but I definitely encourage you to sign up for our email list and or our texting list. That information, again, is at the bottom of your screen or in the description for our YouTube watchers. All right, I'm just going to share this final message before we officially close.
Hey there, have you heard of us? We're a small team of tutors here at A Step Ahead Tutoring Services. We believe that education and information should be accessible to everyone, regardless of income, race, or creed. We're dedicated to making this happen, but we need your help. Please consider making a donation to our company. No amount is too small. Your donation will allow us tutors to remain employed, offer free and low-cost services, put on productions like this web series, and reach out to families nationwide. With your help, we can tackle the academic challenges of our students and the emotional, mental, and behavioral changes that result from these challenges. As a bonus, we can improve our communities in the process. Support us today. Note: we're a for-profit company. We're not a charity. Your donation may not be tax deductible. Please consult a tax professional.
All right, you guys, and that's it for our episode. Thank you so much for watching. I look forward to seeing you at the next episode. And now, I am signing off. Bye.